Once scheduled for a hernia surgery, the amount of time that you're going to spend in the hospital becomes an important question for patients as they're planning their day and trying to understand what to expect. So this question is obviously going to be answered differently depending on the patient's medical comorbidities, depending on what type of surgery they're having, whether they've had previous surgery in the area, and also just a factor of your surgeon, the team in the hospital, and the normal protocol for patients coming into and leaving the hospital after surgery. So for our patients, in general, most operations last around 45 minutes to 2 hours. The 2 hours would be patients who have a hernia recurrence or have some other complication or previous surgery in the area. And normally we can anticipate this and let our patients know in advance. For those patients who do not have any of those things, normally a hernia surgery takes around 45 minutes for the mesh repair and maybe a little bit longer for the tissue repairs. That said, however, you still do have to come into the hospital usually about an hour and a half before your surgery time. You're there kind of getting prepared during that period to go to the operating room. Then you go to the operating room and need some time to go to sleep if you're having general anesthesia, or just to become a little bit more drowsy or sleepy for the IV sedation and local numbing medication anesthesia. And then after surgery, usually it's about 1 to 3 hours in the hospital afterwards. Again, those who have the local numbing medication and sedation medications will tend to wake up quicker and get out of the hospital quicker. And those who have general anesthesia do require a little bit longer of a recovery period, and those people tend to be on that 3-hour mark. So in total, our patients are in the hospital for around probably about 4 to 6 hours, depending on several factors. And if you do have this question, it's a really good idea to reach out to your surgeon and ask them to figure in all of the factors that pertain to you specifically, and that way you can get a better sense of exactly or at least a range of how long you'll be in the hospital.